Welcome back. Again, we're going to continue on with our leg muscles now, and we're going to do the hamstring group of muscles. So on the last video lecture for the muscular anatomy, we were taking a look at your quadricep muscles there on the anterior side of the thigh, which are important for hip flexion and also knee extension. And now we're going to rotate around and we're going to look at some antagonists of those muscles. Remember, antagonists do the opposite movements, and those are called your hamstrings. So let me turn on my multiple select here. And on the left leg here, I'm going to highlight the three hamstring muscles. 1, 2, and then 3. There are 3 of them. So you got one over here that's lateral. And that one is actually called the biceps femoris. So we have another biceps muscle. So biceps brachii is in the brachial region, upper arm. Biceps femoris is a 2-headed muscle, and it's located along the femoral region of the thigh here on the posterior side. Let me deselect that one. And then zooming in here, let me deselect this one for a moment. This muscle is called the semitendinosus, okay, and it's on the medial side of the posterior thigh. This is lateral over here, medial over here. And then underneath that one, deep to that one, well, it doesn't want to deselect, hang on. Deep to that one right there, that is the third hamstring muscle, and it's called the semimembranosus. So unfortunately, you've got 2 there with a very similar name. Semitendinosus is right there. Semimembranosus is underneath, and it flares out. A way to remember which one is semitendinosus, which one is semimembranosus, is the semimembranosus extends a little more medial out to the side. It's also medial looking. It's a medial muscle. So that might be another way to help you remember those. Let me go back to single select here. All right, so let's take a little bit of a closer look at the biceps femoris. And okay, so it is a 2-headed muscle, so it's got kind of divided up into 2 parts, and the other part is right there. That's actually part of this same muscle also. All right, and let me highlight that head, the long head of the biceps femoris again, and let's turn on our pens. And let's zoom in down in here. The blue marker there, that's showing us where the biceps femoris is inserted. So that's the part that's going to move when this muscle contracts. And the origin is actually up here on the pelvic bone. Deselect that for a second. Let me hide gluteus maximus. Highlight the, there you go, right there. There's our pin for the origin of the biceps femoris. So it's up here on the posterior side of the os coxa pelvic bone. All right, so we can see those fibers are running down the leg, and then they extend over here. There's a tendon. They blend in with the tendon, dense regular connective tissue that attaches to, what are we attaching to there? Let's highlight that. That is the fibula, the lateral lower leg bone. Okay, so when that muscle contracts, what is it going to do? If we're looking at our leg from the side over here, it's going to be pulling on the fibula. So what's going to happen to your lower leg? It's going to sweep upward in that direction. Okay, so this muscle is going to be important for flexion at the knee. And also, since it's pulling over here on the lateral side, if you look on your actions for the biceps femoris, it's involved in laterally rotating the leg. Another thing that it helps out with is extending the hip. So we said these muscles are antagonists to your quadricep muscles, which on this side, let me zoom out a little bit more. If we think about the quadricep muscles pulling upward on the thigh, that is hip flexion. So your hamstrings are pulling this direction on the thigh, on the reverse side, and that's going to be involved in hip extension. They're going to be pulling backwards like that. So that's going to extend the hip. You're going to straighten up this joint, and when they're pulling on these lower leg bones down in here, that's going to cause you to flex your knee. So those are important muscles. You use them for multiple movements. All right, biceps femoris. Let's clear all our pins. That one is a synergist, so it cooperates with the semitendinosus right here and the semimembranosus that's deep to that one. And let's highlight the semitendinosus for a minute, and let's turn on the origins and the insertion. So there's the origin up in there. It's also up here on the posterior side of the os coxa. And then your insertion, there's our insertion pin down in there. What is that connecting to? Let's scan down, kind of zoom in, rotate around. That is, oops, highlighted the wrong thing. It's connecting to that bone right there, which is the tibia. So the tibia is the more medial of your two lower leg bones. So that muscle is actually going to be pulling on the tibia in much the same way that the biceps femoris over here pulls on the fibula. So this is also going to be used for those same movements, hip extension, knee flexion, but also medial rotation of the leg. The hamstrings can play a role in that since they're pulling on the medial side rather than the lateral. Semimembranosus under there, essentially origin and insertion very similar to the semitendinosus, and it is going to assist the semitendinosus in making those same movements. You can see there the actions on your study guide are essentially the same for that muscle. All right, those are your hamstrings, and now we're going to take a look at some additional leg muscles you need to know and talk about what their actions are. Next one on the list is the tensor fasciae latae or latae. And this one is actually up in here. It's up located at the hip. Let me highlight that for a second. The gray tissue that you see there is dense regular connective tissues like these other gray tissues that we see. And okay, so let me show that back in there. So you do have some connective tissues that are overlying the muscle. The tensor fasciae latae or latae muscle, or TFL is an abbreviation for that, is actually located right in here along the side of the hip. So if we review the muscles that are up here at the hip, gluteus maximus is the most posterior, and then remember you've got the gluteus medius there in the middle. And if we rotate around a little bit more in an anterior direction, there's your TFL or tensor fasciae latae. All right, and then notice that muscle is connected to, you've got a long band of dense regular connective tissue. That is called your iliotibial tract. Ilio referring to the ilium, and then tibial is referring to the tibia that it connects down into. And it is a tract. It's basically like an extremely long tendon. And this is something, if you have tightness up here in the muscle that's underneath the connective tissues that you see there, if you have tightness that develops up in here, that tight muscle pulls on the ITB. You'll hear runners complain about problems with their ITB. That's the iliotibial tract. And that can pull on the lateral side of the tibia down there where that ITB band is connected, and it can cause a lot of pain. I've experienced that before, and it's miserable. So that is not an unusual injury for runners and some other types of people to experience. So what is this muscle doing? So if we think about it, here it is. Let's show the pins for it. Let's zoom in back up here at the hip. So the origin is actually up in here on the ilium at the pelvis, up in there. Here's your insertion down here into this iliotibial tract. So it's pulling on these dense connective tissues that are connected down here to the tibia. So what's going to happen? What do you think is going to happen there? This is over here on the side. When this muscle contracts, it's going to pull your leg outward like this. So this is one of the muscles that's called a hip abductor because you're pulling the leg away from the midline. That is abduction. You're taking the leg away from the body. We're abducting it. Also, because of the weight, now we talked earlier about how the gluteus medius over here is also a hip abductor. And you notice your gluteus medius is actually kind of right in the middle of the hip. So when that one is mainly contracting, your leg's going to go directly out to the side. When your TFL, because it's a little bit more positioned on the anterior side of the hip, it's going to help you out when you abduct and bring your leg forward in a forward direction. Kind of like with a doggy leg lift. If you were down on all fours and trying to mimic a doggy leg lift, your TFL muscle would be involved with that. All right, so moving on. The next page here on our muscle study guide, the sartorius muscle. This is a cool one. This one right there, and over here on the left side, there it is. This is a muscle that wraps all the way around from the lateral side of the hip. Re-highlight that one. So you can see where it's attached up there. It's on the ilium of the os coxa. And then it wraps all the way around, runs down the medial inside of the leg, and connects down here into the tibia. So that is called the sartorius muscle. So this one's interesting, the type of movement that it makes because of the way it is configured. It's wrapping around the leg. The origin is up here at the on the pelvic bone. Insertion is down here at the tibia. And the way those fibers kind of run in a spiral around the front of the leg, it can be a little bit difficult to envision the type of motion that it's making. But the action is flexes the hip when lifting and everting the knee. So eversion of the knee would be turning your knee outward like that. And it's helping out with, it's a hip flexor because it's connected up here to the pelvis and it's extending down here to the lower leg. So it's going to help raise the leg upward. The best way to visualize what this muscle does is when you sit Indian style, when you sit down like that, this is your sitting Indian style muscle where it's going to bring the leg upward. You're going to flex the hip, bringing the thigh upward, and then you're turning your knee outward. So if you think about sitting in Indian style position, that's one of the main muscles that you're using to accomplish that. So that's a pretty easy one to recognize because of the way it wraps around. Okay, so over here on this side, we talked about how we have these hip abductor muscles, gluteus medius, TFL. On the medial side of the thigh, you have various what we call hip adductor muscles. All right, and I'm going to, on your lab guide, I'm going to skip down to this one first. This one is called the gracilis. I'm going to rotate around to the back side. You can see the gracilis a little bit better. So the origin is up here on the lower part of the pelvic bone, the os coxa, and it runs all the way down the inside of the thigh, medial side of the thigh, and then it's going to connect into the tibia down here around the knee joint. So if you think about flexing that muscle, what is that going to do? It's origin up here, it's pulling on the knee down in here, so your motion is going to be like this. It is adducting the thigh, adducting the thigh. So you're bringing it toward the midline of the body or even across the midline of the body. That is called adduction with a D rather than abduction. So that's one of your adductor muscles. Actually, this one also, because of the way it's positioned, it connects into the tibia. It's also involved in helping you flex the knee. So a lot of these muscles have multiple roles that they play. All right, and then some of these other muscles that you see on here, let me deselect that one, are also called hip adductors. That one that I'm highlighting there is called the adductor magnus. Let me take off the gracilis. Let me hide that one. All right, you got one there called the adductor magnus. That's a pretty large muscle. And then this one is called the adductor longus. So both of those are examples of hip adductor muscles. And you don't have to learn one from the other. Just recognize if those muscles are highlighted and it's not the gracilis, it's not the sartorius, that those are other hip adductor muscles. There they are on that side, right there and right there. This one that you see right in there, that's called the pectineus, and that is a hip flexor muscle. You'll hear people talk about, I injured a hip flexor, and sometimes it's that one, sometimes it's this one, the psoas major, sometimes it may be this one, the iliacus. There are a whole bunch of them there that are deeper muscles that are involved in hip flexion. You'll hear people talk about injuring hip flexors, and that's what a lot of times that's what they're referring to, some of those deeper muscles. Those are common injuries in gymnasts. You don't have to know the psoas and the iliacus. I just wanted to point those out to you because you do hear people talking about hip flexor injuries fairly commonly. All right, I'm going to end this particular video lecture here. On the next one, we'll do the lower leg muscles, and that will finish out all of the muscular anatomy. So see you on the next video.